Okay, we're here with Dr. Azim Kasmani. I'll see if I can get this right. Public Health and Preventative Medicine Resident Physician at Queen's University. Is that
You
right?
got it.
There.
Yeah.
Got to get something right every once a day. So yeah, this has been a bit of an up and down week, a little bit yo-yo since we last spoke. There was sobering news and stark numbers handed down by the Premier on Friday, and then a little bit of good news this week in terms of how Kingston's faring in all of this. What's your news report for the week?
I think overall, we are really happy with how seriously everyone in our community is taking this, how everybody is really working hard and doing their part to make sure that that they're practicing the physical distancing. They're staying home. They're only going out when they need to. And as a result of all that, we've seen that we haven't had a new case in our area in the past 2 days now, I think. And our numbers are steady at 54 cases now. That doesn't mean that's not going to change. That's not going to go up. But that's a really reassuring fact that we're seeing now. We're also not seeing additional admissions to the hospital for people needing critical care or ventilator support. So that's also reassuring. And that's giving us time to work on all the other things we need behind the scene, that in the event that there is a surge of cases, we're ready and able to treat people.
One of the things that was announced, I guess, this week is that now there's, between Queen's, the city, I guess St. Lawrence College, the hospitals, they've now prepared 1,000 beds to deal with this. Now, are these acute care beds, or are these just places where people can go to and not necessarily be intubated or treated or whatever?
There's a variety of plans in place, and we're working on them. So some of the beds are already ready to go. KHSC and KGH have done a lot of work to get an additional capacity within their hospital. And patients and staff have really been helpful with that as well. So that's where the primary spot is, and those would be acute care beds. There's also a lot of work that's been done at Providence Care Hospital to create some additional capacity there, both for patients at KGH who are not COVID patients or patients with COVID, but have other issues and have needed some additional rehabilitation or additional time in a hospital-like environment. They've gone there. And in addition to that, they've made some extra capacity in the event that there is a surge of patients with COVID, that they can be treated there as well. Beyond that, then we've looked at other options to open up additional sites in the various locations that you mentioned, depending on the numbers. And so it really depends on where the numbers are, how many we need, and we would scale up a response as a result of that.
How are your colleagues holding up in all of this?
I think everybody's holding up pretty well, especially here locally in Kingston. Because our community has taken so many measures and have all really taken to heart the physical distancing, and we haven't seen that big spread here. It's bought us a lot of time to be able to prepare well, as I was saying. And so as a result of that, it lets us take a breath in and think more broadly, rather than just having to deal with a surge of patients right away. You have time to think about the next steps and what you can do to prepare, like creating these additional beds, like finding ways to get additional staffing and support, for example. So that's really been helpful, and I think we really appreciate the community doing their part.
We've been visiting now, I guess this is the 4th week in a row.
Yeah.
Maybe just tell our viewers a little bit about yourself and your professional life. What were your specific duties before this all happened, and what are you doing now?
Yeah, so I'm a public health resident, and so before actually here from July to January, I was working in Hastings, Prince Edward County out of the Belleville Public Health Office there. And in our training, we go through different rotations. And this, it's the bread and butter, what public health does every day. So there's communicable diseases, there's environmental health, there's policy, there's chronic disease and injury prevention. So these are different rotations that I have been working on. All of that continues in the context of the COVID outbreak now. So it's all the same public health work we do day in, day out, every day of the year, preventing people from becoming ill. That's our main goal. And so that is continued into this, but it's focused on this disease now because it's such an acute event that's come up. And in order to make sure that we prevent people from getting the illness, that's our big goal. And then helping out our health system partners in treatment as well, including, for example, we just talked about the additional healthcare facilities that may need to come online.
Okay, so I guess what I'll leave it with today is one of the things that's definitely happened over the last week is increasing, I don't know if awareness is the right word, or just the increasing need that people seem to feel to wear masks. There's been a lot about that. Originally, we were being told, well, unless you know how to use them properly, don't bother because you'll do more harm than good. Now people are starting to think that they should wear a mask every time they go out in public. Can you give us a little bit of a balance, a little bit of a sense of what really is the people should be doing?
The answer is that the science isn't yet settled. Masks may help. What we know, though, is that there is a shortage of medical grade masks around the world because of supply chain issues. So as a result of that, we are asking the public to save those masks, the healthcare grade masks, the surgical, procedural, or N95 masks for healthcare workers, because they need them in their higher risk setting when they're working in the hospital.
So what's
cloth masks?
Yeah, I was going to ask you about that. What's your take on, okay, so the medical grade masks are being kept for the people who really need it.
Yeah.
What about somebody who takes an old scarf and throws it around their face and goes out? Are they doing more harm than good?
There's a couple of different things. So first of all, the Chief Public Health Officer of Canada came out and said that there may be some role for homemade masks or cloth masks, but you do have to keep a few things in mind. One, the main role that they provide, or that they, the main role they serve is protect, or is if you have an illness, they may help stop the spread of that illness from someone else. They're not necessarily very good at keeping you from getting an illness from somewhere else. That, again, that's the best science we have right now, and we're learning so much at such a rapid pace. As we've talked about, every hour there's new information coming out, and so that's where the information we have right now stands. So if you are using them, don't get complacent, don't stop the physical distancing, and don't think, well, I have the scarf on my face, I'm fine. The way you take them on and off, if you're touching them, you have to wash your hands after because there may be something on there that you don't want. You want to not keep adjusting the mask and touching your face, because then that's another vector for getting viruses on your face. And if they're soiled, dirty, wet, they need to be washed. If they're reusable, they're not very effective then either. And if you're in a situation where you would need a medical grade mask, and the general public shouldn't be, but in certain industries there may be, then those masks may not provide the protection that you need.
So if you're looking at after somebody at home, for example, if you have an elderly relative who's at home who has not, has symptoms but not been diagnosed yet, and you're looking after them, in that case, you should definitely try to wear a surgical mask or a medical grade mask.
Well, I mean, in that case, if there's somebody that's at high risk of being a probable case, public health will be in contact with you because you would be a close contact. There's specific guidelines. But for example, if there's a home care worker, a nurse going into the home, or someone else going into the home, then they should be wearing a medical grade mask in that case. But for families, public health will provide you with some information on how to best care for loved ones at home.
That's good to know. Just, I guess, one, we talked about earlier the good news in Kingston, that we seem to be keeping this thing under control. What would you say? We maybe just remind people that the reason that it's under control is because people are social distancing, because they're being good at the supermarkets and staying back. This is not the time to get complacent or to think, hey, we've got this thing licked.
Yeah, exactly. And what we see is everything has a lag time of up to 2 weeks. So the things we're seeing now are the actions we took 2 weeks ago that are really now coming through. Hospitalizations and deaths take even longer than that because it takes 2 weeks for people to develop symptoms and then another 2 to 4 weeks for them to get really sick or die in a lot of cases. So we have Easter coming up. It's Passover this weekend, and Muslim and Ramadan's coming up. And these are times when we normally spend with our families and get together. But I know that we need to, like for my family, my parents don't live locally. We're going to use video chats like we are here to keep in touch, to have dinner together in that way, rather than all getting together in person. So we have to keep these, our physical distancing going. And find other ways to connect socially with our family, our loved ones, our friends, to celebrate these religious occasions. Easter is also a time when we have a long weekend. Often, the weather might be nice. We'll be getting together with friends for barbecues, etc. We have to avoid that still and make sure we keep going so we don't see a rise in the cases in a couple of weeks from now.
So it's basically an example of keep up the good work, Kingston,
yeah.
and we'll get through this.
Yeah, exactly. And it's been nice to see. It's really been heartening to see how everybody is really doing their part.
Good note to end it on, and hopefully we'll have more good news next week when we talk. Dr. Kasmani, we'll leave this for next week and we'll talk to you then.
Take care. Thanks for having me.
All right, thank you.